In this video, I'm going to show you surgical excision of traumatic fibroma. The etiology of the fibroma is the constant trauma from the orthodontic brackets. As the surgery involves only the lip region, I am giving only the mental nerve block for anesthesia. I also infiltrate the soft tissue surrounding the fibroma with adrenaline to minimize the bleeding during the surgery. The tissue around the fibroma is also thick and fibrous because of the trauma from the orthodontic bracket, so I plan to excise that area also along with the fibroma. I check for the subjective symptoms of the mental nerve blocks in the premolar region and then in the surrounding area of the fibroma. I am palpating the lesion to determine where to place the incision. Then I place an elliptical incision around the fibroma, making sure to include the fibrous tissue. You can see that there is minimal bleeding. This is because of the adrenaline that I injected earlier. Now I am increasing the depth of the incision gradually to reach the underlying muscle layer. The bleeding from the incision line has increased. This is because I have reached the muscle layer and bleeding is from the underlying muscle. Now I asked my assistant to support the lip as I will now be excising the fibroma along the incision. I start from one corner of the elliptical incision. I am separating the fibroma from the underlying muscle using a number 15 blade. Once the fibroma is excised, there are some minor salivary glands seen attached to the muscle layer. I am excising these glands carefully not to damage the muscle. This is the underlying muscle, that is orbicularis oris. Now I'm freeing the lip epithelium from the muscle. This step is not absolutely necessary, but it is advisable as it reduces tension along the sutured incision line. I am doing the same on the other side. I now suture the surgical side with a 3-0 silk suture material using a simple interrupted suturing technique. In this case, 4 interrupted sutures are enough for a good primary closure. This is how the surgical site looks immediately after the surgery. After the surgery, the patient is asked to apply modeling wax over the orthodontic brackets. This would avoid traumatic injury to the surgical site from the orthodontic brackets. This would also prevent recurrence of the traumatic fibroma in future.